All right, good morning. Welcome to the Finance and Fiscal Resources Committee. Our first item on the agenda is public comment. If there's anyone who wishes to speak, please stand up, state your name, your address, and you have 3 minutes. Good morning.
How you doing, everybody? My name is DeAndre Jones. I prefer D. Jones. I stay at 967 Tamarack Avenue. I actually want to thank the health department. I actually got one of the water filters that you guys were giving out. I was able to bring that water filter to my house. I didn't know how to install it just because I got a crazy looking sink, and they actually came out to my house and they actually installed this water filter for me. So now I actually got a nice water filter. I'm able to get some good clean drinking water. It tastes way better. You can actually taste it. And I've been able to bring that to my family. I have a family that's family that grew up in poverty, very underserved, under-resourced family, and to bring something like that to my house and to be able to see my mom, be able to look at this water filter is a pretty unique thing. And so I really want to thank Kent County for being able to provide water filters to families, just because water is essential to life. The human body is, I believe they say about 90% water, somewhere around there. And so I want to really thank Kent County also. As I've spoke about, I had a cousin who passed away. He got killed in Chicago at a gas station for some street beef and things like that. And I'm looking to develop a program for esports for kids on probation and surveillance. As I work with these juveniles in the court system and the criminal justice system, I hope to get the Kent County Sheriff's Department to actually come give a workshop or an educational workshop to these juveniles to let them know what the next steps could be if they continuously commit crimes in Kent County, but also that the Kent County Sheriff's Department isn't there just to lock people up. There are different duties and things that they do around the community that are good. And so just bringing a general education around that so people can stop thinking that Kent County sheriffs are just police officers, just people are just there to lock you up. Usually when you do bad things happen. And so I just want to be able to help my community, help these juveniles. I was that same kid. I'm just trying to use my experience and everything I've been through as a human being to make my county better, make my community better, make the state better, and be a leader and continuously inspire the people around the community. And hopefully you guys are inspired by the work that I do. I don't really get to talk to you guys. You guys really don't talk to me, but I come here and I speak to you guys a lot, and I don't do this for my health. I'm tired. And I'm usually yawning, but I'm passionate, and I know that I have to show up, because usually if I don't show up, I usually don't see other people showing up, unless it's something on the agenda that affects them. And so I continuously show up just because I care about this community, I care about you guys, I care about all people, and I just want to see this community in a better place, and I want to see the school to prison pipeline not a thing. I don't think I'll be able to stop everything, but I know I'll be able to stop some things. Thank you.
All right, is there anyone else for public comment? All right, seeing none, our next item on the agenda is the consent agenda. Is there a motion for the consent agenda? Moved. Is there support? Support. Support. All those or any questions or comments? All right, all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. Next item comes from the Health Department. It's the Office of Global Michigan Refugee Services Grant Program.
Action requested. Recommend to the Board of Commissioners to accept and appropriate an additional $270,000 to the 2024 Health Fund budget for the Office of Global Michigan Refugee Services Grant, and authorize the Board Chair or his designee to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. Summary. The Health Department has received additional funding from the Office of Global Michigan Refugee Services to support refugee-related services. This request is to appropriate $270,000 for 2 new public health nurse positions approved by the Legislative and Human Resources Committee at its meeting on September 12, 2023. The Office of Global Michigan and the Health Department have partnered for over 25 years to provide refugee medical screens. Public health nurses provide screenings that cover medical history, health assessment, screening for communicable diseases, and a mental health screening. The Office of Global Michigan has indicated that Kent County will likely experience a need to provide health screenings to refugees in fiscal year 2024 and 25. The grant funds will support the addition of 2 full-time public health nurse positions with salary and fringe costs of $104,800 each. Funds will also support client transportation assistance, staff travel, cell phone, computer, and software needs, and indirect costs. The grant period is October 1, 2023 to September 30, 2024. If funding is eliminated or decreased, the positions will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations.
All right, thanks, Al. Is there a motion for this item?
So moved.
Moved by Commissioner Wooden. Is there support?
Support.
Support by Commissioner Green. Questions or comments? Yes, Commissioner McLeod.
Chair, so I just had a couple questions about this one. A couple things in specific. Is the number of anticipated refugee or refugee-like, I think it said in the refugee-like arrivals, is this number something that is fairly certain? Because I'm just concerned, I guess, about bringing 2 full staff persons in. And this funding is actually only for 1 year, so are we anticipating that the funding will continue that has been supporting the other people, I guess, that have been hired on this? But it seems like bringing 2 new people in with 1 year of funding for a number that it doesn't appear that it's really solid of refugees that are coming in is something that we want to move forward with. I just want to get some clarification.
We have Gail Brink from the Health Department with us this morning.
Yeah, good morning. I have John West up here. He's the supervisor of the program, but the state has told us to anticipate an increase of almost double what we're currently have. We take about 700 or 750 every year so far, and I think there's the award letter from the state that's attached, and they said to anticipate about 1,400 coming in, and that they're anticipating that it will be for 24 and 25, and then thereafter potentially, it's hard to predict what it will be, but they're anticipating that for at least 2 years.
So I guess my question, yeah, and so just following up on that, so is there a reason that, is this funding only provided on an annual basis, or because there was another one that it was a 2-year grant, and so I'm just wondering why this isn't a 2-year grant when the estimation in terms of the number of people is based on 2 years?
The state contract is for, it's a continuation, but they award it every year. So, that's why this is for 1 year, but I believe in the award letter, it said it was anticipated to continue into year 2. So
Okay, thank you.
Thank you. Any other questions or comments? All right, seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. All right, thank you. Our next item comes from the Health Department, and it's the Michigan Health Endowment Fund, the Health Equity Capacity Building Grant.
Action requested. Recommend to the Board of Commissioners to approve the MHEF agreement, accept and appropriate $75,000 to the 2024 Health Fund budget for the Health Equity Capacity Building Grant, and authorize the Board Chair or designee to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. Summary. The Health Department has received a 2-year $150,000 grant from MHEF to support community-based and community-led work that creates a sustainable foundation for cross-sectoral collaboration and coordination to address key health issues. This request is to appropriate $75,000 for the first year of the grant to the 2024 Health Fund budget. The remaining $75,000 for the second year of the grant will be included in the Health Fund's 2025 budget. One of the main goals of this project is to bring systems together to decrease duplication of services, improve communication, build trust, align efforts, and provide resources and support for identified community health issues, ensuring sustainability to create long-term change. Hospital and healthcare systems, academia, government, business funders, and community-based organizations are included in these efforts. The grant covers the cost of the Health Department staff who will facilitate the work, contractual payments to community partners, and indirect costs. The grant term is October 1, 2023 through September 30, 2025. Assistant Corporate Counsel will review and approve the agreement as to form prior to signature.
Thanks, Al. Is there a motion for this item? Moved by Commissioner McLeod. Is there support?
Support.
Everyone wants to be supportive. All right, Commissioner Oliver King. Any questions or comments regarding this item? Yeah, Commissioner McLeod.
It's me again. Thank you, Chair. Just a question on this, or actually two questions. So is this work currently being done in the Health Department? Because it sounds like there's going to be staff that are maybe working on other things that will move over to working on this. And then secondly, what are the contractual payments that will be made to partners? Because that's a pretty large amount of a portion of the $75,000.
I have Brian Hartle. He kind of oversees that program, and I'll let him go ahead and address those questions.
Morning, everybody.
Good morning.
Thanks for the questions. Yes, this work is currently being done. We started last October. We got some funding from the Michigan Department of Health and Human Services and the Michigan Public Health Institute to start this work in October. And this is kind of just some additional funding that we have in place that we applied for through the Michigan Health Endowment Fund. The contractual dollars will be mainly spent towards compensation of community members who are part of the council that we have to ensure that their voice is heard. We have also done mini grants through this work to fund community-based organizations to implement programs that meet the needs that were voiced by the community members involved in the council. So the majority of the contractual services or funding will go towards compensation of members as well as those mini grants.
And just a quick follow-up. So are those community organizations, are they mainly like neighborhood associations? Are they other types of groups that are more focused on very specific things in the community?
Yeah, so they're organizations that represent different populations in our community. So we focused on the different racial and ethnic populations who are in our community, as well as some geographic locations. So zip codes that have high social vulnerability indices. We have like the Baxter Neighborhood Association, for example, is work. They received a mini grant through this past year. And so, yes, we try to get organizations who represent, the diverse population that we serve here in Kent County. So right now we have 10 different community-based organizations who serve on the council.
Thank you. All right, thank you. Any other questions? All right, seeing none. All those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Next item here comes also from the Health Department, and it's the Michigan Health Endowment Fund, P3, Parks People Produce Grant.
Action requested. Recommend to the Board of Commissioners to approve the MHEF agreement, accept and appropriate $208,000 to the 2024 Health Fund budget for the P3, Parks People Produce Grant, and authorize the Board Chair or designee to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. Summary. The Health Department has received $208,000 in grant funds from the MHEF to transform inequitable environments with populations that are high risk for chronic disease due to lack of access to healthy foods and physical activity. While the grant award indicates a 2-year grant period beginning October 1, 2023, the Health Department has only been awarded funds for the first year to implement a pilot program. P3 aims to empower residents to reduce health inequities through improved access to farmers, markets, food pantries, parks, and green spaces. The P3 pilot project will support ongoing efforts to mitigate risk factors that contribute to disproportionate rates of diabetes and cardiovascular disease, reduce healthcare costs, and improve quality of life. Through a partnership with Roosevelt Park Neighborhood Association, the Health Department will pilot the program with families and youth who reside in the Roosevelt Park neighborhood. The grant covers the cost of existing Health Department staff who will facilitate the work, contractual payments to community partners, supplies, travel, promotional materials, and indirect costs. The grant term is October 1, 2023 through September 30, 2024. Assistant Corporate Counsel will review and approve the agreement as to form prior to signature.
All right, thanks, Al. Is there a motion for this item?
Motion.
Support.
Moved by Commissioner Oliver King, support by Commissioner Wooden. All right. Questions, comments? Yes, Commissioner Wooden.
Just a comment. I'm glad to hear that the Health Department is intending to partner with Roosevelt Park Neighborhood Association. RPNA is one of the best run, well-established NAs we have in the city of Grand Rapids. And I say that as a former board member of the Creston Neighborhood Association, which is also, well, frankly, my favorite one. But regardless, RPNA is fantastically run and very, very well vested in that community. They have phenomenal relationships with their neighbors, and definitely the right choice to make. So, well done.
Any other questions or comments? Yes, Commissioner McLeod.
Just a comment. I thought that this is great. I mean, given that there's, so many food deserts across, the county and the state, I'm excited about this pilot and to see what comes of it, because it seems like it's a great way to address some of those needs for fresh food, fresh produce, those sorts of things within communities. So I will be looking forward to the report on this once it comes out.
Any other questions or comments? All right. Oh, yes.
I'm just curious how many people are going to serve the Sunday?
Amy Ostrink, who is the program supervisor overseeing the program, answer that question. She has more information.
That's a good question. Exactly, I do not know the number. That will be something that we'll dig into when we start meeting with the residents themselves. The goal of this grant is to have them tell us what they want and what they need, and what their priorities are. It's not just including the adults, it's including the children and the youth as well. So we will be meeting with Roosevelt Park Neighborhood Association, Amy Brower, and her team, and actually gathering information from the residents in a number of capacities. So, would you like me to report on that later in a year?
Absolutely. All right, it's great to hear that the kids will be included in those conversations as well. They definitely have opinions, at least mine do. Any other questions or comments? All right, seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Next item on the agenda, item number 6, comes from Fiscal Services, and it's additional 911 surcharge appropriation.
Action requested. Recommend to the Board of Commissioners to appropriate an additional $400,000 in 911 surcharge revenues to the 2023 Central Dispatch Collection Fund budget. Summary. The county levies a surcharge on telecommunication devices for 911 dispatch services, which is collected by telecommunications carriers. Kent County voters approved increasing the 911 surcharge fee from 45 cents per line to $1.15 per line beginning on July 1, 2017. Upon analysis of funds received for E911 surcharges in September of 2023 relating to January through September 2023, it was noted that receipts exceeded projected revenue for the 2023 year. Further, Fiscal Services staff concludes, based on the data collection and analysis, the county is receiving the correct surcharge amounts from providers. An additional appropriation of $400,000 is required to allow for distribution to the Kent County Dispatch Authority.
All right, thanks, Al. Is there a motion for this item?
So moved.
Moved by Commissioner Wooden. Is there support?
Support.
Support by Commissioner Sparks. Questions? Commissioner Wooden.
It's me again this time. There's an old saying and for those of us who've been candidates in the rostrum, there's an old saying in campaigns, numbers that end in 0 or 5 are not real numbers. So I'm just wondering, is this $400,000 one that was created to be inclusive of how much we expect to receive for the remainder of 2023 so that you all don't have to come back here, so everything is authorized to flow through the dispatch authority, but we're not expecting $400,000, correct? The thumbs up from Mr. Dode suggests that was correct. I just wanted to confirm that before voting. Thank you.
All right, any other questions or comments? Commissioner McLeod.
So that helps explain some of what my question was, because I was just wondering, like, if we're, collecting the amount that we're supposed to collect, why is it that we are now 400,000 off from our projection, our original projection? I remember talking about this in LHR quite a bit when I was on that committee, in terms of, the providers and the amount they collect aren't necessarily easily trackable, all of that sort of thing. What's happened, I guess, to change this, and might our projections next time around be a little bit closer to what we think they should be?
I'd like Jeff to answer that. In short, even though we're allowed to raise the funds, so the providers are not required legally to give us detailed reports, and so it does make the job harder to actually make sure that we're receiving what we should. But I know Fiscal has made some progress on that front.
Yeah, good morning. So we never know, the law doesn't allow the providers or allow us to get information on the number of customers they have. So we take our best guess at the beginning of the year. The 9-month budget may have had a little bit of issue with it too due to collections. So next year we'll probably estimate a little high. This just means there's more subscribers than we anticipated, so we have additional revenue. So it's a good thing overall.
No, I agree, it's a good thing. It just seems like there should be, I thought, it's been a while since we've had this conversation. I just thought there would have been a little bit more progress, so, all right, thank you.
I think the only cure for this would be the state requiring providers to let us know how many customers they have, and that way we could tie it up and know what exactly we're supposed to be getting. So short of that, it's never going to be perfect.
All right, any other questions at all? All right, seeing none, all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. Next item comes from the Administrator's Office, and it's the West Michigan Welcome Plan Annual Global Gathering Event.
Action requested. Recommend to the Board of Commissioners to appropriate $16,080 from various donations for the West Michigan Welcome Plan Annual Global Gathering Event to the 2023 Kent County Welcome Plan budget in the Special Projects Fund. Summary. The Kent County Welcome Plan was created with 36 partners to identify initiatives that welcome and support refugees and immigrants in community engagement, economic well-being, safety, education, and access to services. The Welcome Plan Collaborative continues to expand its network and currently includes representatives from 50 organizations. The Administrator's Office is expecting to receive $16,080 in donations from community organizations to help support the West Michigan Welcome Plan's inaugural Global Gathering event, which was held on September 16, 2023. The Global Gathering is planned as an annual event to take place in September as part of National Welcoming Week events and activities. Welcoming Week is a worldwide annual celebration that invites communities to deepen their commitment to creating places that are welcoming to all, including immigrants and refugees. Organizations contributing funds to the Global Gathering event are Bethany Christian Services, Health Alliance Plan, West Michigan Hispanic Chamber of Commerce, Samaritas, Network 180, City of Grand Rapids Community Foundation, Experience Grand Rapids, African Collaborative Network, Motherland Cultural Connections, Steelcase Inc., and Treetops Collective. These funds will be used to offset the balance incurred to host the event. The 2023 Global Gathering event is the Welcome Plan Collaborative's first large-scale event and is key to bringing together cultures from around the globe to celebrate. The Global Gathering featured a range of family-friendly activities representing international cultures and genres, including food vendors, cultural learning workshops by local artisans, and multicultural music dance performances.
All right, is there a motion for this item? Moved by Commissioner Sparks. Is there support? Support by Commissioner McLeod. All right, questions or comments? None? All right, all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. Our last item here comes from the Administrator's Office, and it's the State of Michigan Department of Labor and Economic Opportunity Regional Community Collaborative Grant.
Action requested. Recommend to the Board of Commissioners to approve the Michigan Department of Labor and Economic Opportunities Year 2 Regional Community Collaborative RCC Grant. Accept and appropriate $180,000 to the RCC budget in the Special Projects Fund and authorize the Board Chair or designee to execute the grant agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the original award. Summary. In FY 2023, the Administrator's Office received $81,326.34 State of Michigan Regional Community Collaborative Grant to implement and expand upon the Welcome Plan goals serving refugees and immigrants in Kent and Ottawa counties. The grant period ends September 30, 2023. For fiscal year 2024, the Administrator's Office seeks to continue the RCC grant received in the amount of $180,000. The Year 2 grant will fund the full-time Welcome Plan coordinator and contractual services to support plan implementation, including translation and interpreter services for grant writing, workshops, resources to support community engagement, and meeting and training coordination for the Welcome Plan Collaborative. The grant term is October 1, 2023 through September 30, 2024. The Department of Labor and Economic Opportunity reported to Kent County that they will amend the Year 1 RCC contract in September 2023 to add funding through fiscal year 2024 for the full-time coordinator and welcome plan implementation activities. Assistant Corporate Counsel will review and approve the agreement as to form prior to signature.
All right, thanks, Sal. Is there a motion for this item? Moved by Commissioner McLeod. Is there support? Support by Commissioner Sparks. Questions or comments? Commissioner McLeod.
This is the last question, I promise. Just wondered, so this is great. This is a second year funding for this role, and it sounds like there's definitely been some great things done over the last year or two with this position in place to support the immigrant community. I just wondered, at some point, is this position potentially going to be something that is not only supported by grant funding?
Well, interestingly, we transitioned it from being half paid for by Kent County to being fully paid for by the grant, because that's what the state wanted the grant to pay for. And so we shifted that money to pay for the half-time position that assists this person now. I think if the grant funding went away, this is one where we would seek to restore the county funding for this position. But we continued, I mean, it's been my goal to keep building partnerships in the community and not have this just be a Kent County initiative. That was the spirit in which everybody came together. And so we're working hard to make that happen. But I think for right now, specifically the state wanted to fund this position with the grant money. So we'll probably keep doing that with kind of the plan of what to do for Plan B if the state should stop funding it in the future.
That's helpful, because I mean, it seems like this is something that is doing our community a good service, right? And I would hate just if the grant funding went away, that this opportunity would go away too. So that's helpful. Thank you.
All right, any other questions or comments? Seeing none, all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. That brings us to miscellaneous. Is there any Commissioner miscellaneous? None? All right, we are adjourned, and our next meeting will be Tuesday, October 17 at 8:30 a.m. Thank you.